partner with parents, and so it's a real pleasure for me to share what we have done as a network and how we partner with parents from our 14 local centers throughout the U.S. and Canada to share what we've been able to accomplish just in this past almost 4 years. And it's no easy task. You know, we can't be fooled by the fact that, you know, family engagement, we're all either parents or we work with parents, but it hasn't been an easy task. There's been a lot of work, a lot of unexpected work that we've all, you know, easily took a part of, and it is with that that I share, you know, what we've been able to do. And with the network, you know, we really tackle this from the perspective that family, it's really at the center of everything that we do, as well as the patient or the child or the young adult, keeping them in mind in what we do in terms of our family engagement efforts. And family is defined in very different ways depending on not just, you know, in the location of our sites throughout the U.S. and Canada, but also, you know, our cultural backgrounds, our experiences, and even our geographic location. And we have to remember that families, parents, caregivers, grandmothers, aunts, and uncles, they're really the support system to the family and to the patient. And so we value all of the strengths and all of the skills, all of the experiences that they bring in to continue providing support for families that we serve and to make the decisions, because we know that, you know, a child's best advocate is their mother, their father, their grandmother, or their, you know, grandfather. And so we keep that in all that we do. And we really, you know, try to maintain a philosophy and ascribe to doing everything from a family-centered perspective and a patient-centered perspective. And so that's how we value family engagement. That is how we value families, that they're at the core and at the center of the work that we do as a network, and we keep that definitely going forward. And how we strategize to do that for this network is through the Family Advisory Committee. And so if I can have you proceed to the next slide, you'll be able to see in the next slide that our Family Advisory Committee, it's very important. That's our #1 strategy as a network. But then obviously our 14 sites then take on their own family engagement efforts and their own strategies to integrate families in the work that they do. But nationally, what we've done is we formed the Family Advisory Committee, and you're going to learn more about it through the presentation that Tom Hess is going to reveal to you in a couple of seconds. But, you know, for us, having a Family Advisory Committee, it's really how we plan to achieve our goals of quality improvement, how we plan to achieve our goals of broadening the reach into other primary care providers, into other provider networks, to other clinicians and healthcare professionals. It's really how we see our research moving forward, keeping families integrated in everything that our researchers are doing and our research proposals are going to undertake, so that we can really be great leaders in the autism field and for these networks that we work in throughout our site. And like I mentioned, our ATN care model, which you can have more information on by visiting our website, and Audrey can definitely include that in later on through the presentation or in the recording, is our ATN care model is really a family-centered care model. And our mission is really to improve conditions for all families and children and really move from a clinic-centered model to a family-centered model. And that's really what the members of the Family Advisory Committee have helped us do in these past few years. And so it's with great pleasure and a great honor that I get to partner truly every day with more than 30 parents across the country and in Canada as well to be their staff partner, to be their staff liaison to them at the Family Advisory Committee. And it's an honor to introduce Tom Hess, who I wouldn't be here if it wasn't for him being what I consider a great boss and just showing me so many things about what family engagement truly is about and what I can do to be at their service of all of these families and all of the children and the patients that come through the network. And so, Tom, take it away.
Thank you, Gabby. That was a wonderful introduction. I'm really excited to be here today. I am the co-chair of the North American FAC, so we make sure we include our Canadian partners. I also am the family liaison for the Ohio Department of Developmental Disabilities, as well as a member of the Nationwide Children's Hospital Family Advisory Committee. So families is my business to some extent. Most importantly, I am the father to 2 children, Henry, who is 14 and is a wonderful child, and he has autism, and then my 17-year-old daughter, who is very witty and charming. She'll tell you that herself. I want to take a few minutes and kind of give you a little history of the FAC and the development. Gabby mentioned that this FAC is a process, and it comes up again and again as we start new family advisory committees across the country. It really is a process. It takes some time to go from the seedling to the oak. So I'll give you a little snapshot of how it's gone with the ATN. In the beginning, there was just the idea to make sure that families and children with autism were represented across the ATN and the AARC. They asked Pat Kloppert to be the family liaison or the family advisory committee representative, and she did that admirably. She participated across the board, and she quickly realized that there was an opportunity to involve more families, and B, a real need for there to be more than one person. Next slide. So across the network, we set up the system of having 2 FAC members per site across the network. That's the time when Amy Kelly from Children's Hospital of Philadelphia and myself came on as co-chairs of the FAC. We had the purpose of partnering, advising, engaging, disseminating information across the network, and really more importantly, the experience of participating in all aspects of the network. I know across the FAC, we were truly inspired and included in all the things that happened across the network. We were surprised as a group how often the researchers, the PIs, all the people came to us for our opinion. Frankly, it probably was a little of an issue getting us to express our opinion directly. Now, that doesn't go for a few of us. Some of us are a little more vociferous than others, but across the network, it's really been a labor of love and a real partnership with all the investigators. Next slide. The purpose of the FAC, you'll notice in this slide that perspective is highlighted a few times. One of the great things about family engagement and family integration is family members offer a unique perspective that researchers don't have, that the academics don't have, that no one else has the view that family members and people with autism have. We've had a wonderful experience of real good discourse on the things that are important to family members as it pertains to research, as it pertains to the care model, as it pertains to all the activities across the network. We've really helped out, if I do say so myself, in kind of guiding the research projects. I was saying to Dan when we had a meeting in Boston, I really can see the difference over the course of the past 4 or 5 years of even just the projects that are being undertaken in the research areas. They really translate right over into what the families have said are their most important aspects and what they want to have addressed. Next slide. The other opportunity that we've had, or the other initiative, is really to engage families in every aspect of the network. We are involved in a local capacity at all of our 14 sites across North America. We're involved in disseminating information about the ATN and the research projects. as well as being involved in the quality improvement efforts across the network. I really feel that we've had a significant impact and a significant opportunity to be involved in many of the network activities. Next slide. So just to give you an idea of the growth of the FAC, from Pat Kloppert, way back when, 5 years ago, 6 years ago, we had one person. Now we have 30 representatives across the country, with an average local membership of 8 people. We're very involved across the various sites and different activities. We have a number of community-related activities. That's the one thing that family members really bring to the table is we are the connection to all of our communities at our local sites. We are the people who are out there living lives in the communities, interacting with the providers, interacting with the physicians in the network. And it's a great opportunity for collaboration. And then maybe one of the most important numbers is that total number of FAC members across the country, more than 80 people across the country and Canada involved in the FAC, really making a difference every day in what goes on across the network. Excuse me. Next slide. So we've really reached a point in our FAC where we're taking the next step. Engagement, typically we try to engage families on a hit or miss aspect. Sometimes we miss that because of schedules, because of busy families. If the families aren't engaged in the entire process, sometimes we miss that family engagement. We're really looking towards family integration, making sure that we include families' input and perspective from the very beginning of research through the end and the conclusion. When we start to design ideas, review, implement, any of those activities across the network, a family member needs to be part of that. I think the ATN and AARC have done a fantastic job of trying to make sure that families are represented in all areas. Many of the trends in the business that we are all in are person-centered medicine, family-centered medicine. You heard of the medical home model, care coordination. Many of the things really have the family and the individual at the center of the process, which is really changing the face of research as we move forward. Next slide. Engaging families is really an opportunity to integrate families into the entire process. We found that there are a lot of hidden treasures across the FAC. There's never a meeting that goes by where someone doesn't chime in, well, in my professional life, I'm also a statistician, or I'm also a social worker, or I work for the hospital. Many of the folks that are family members are also involved in the system in some way and have a skill set that they really bring to the table that will be very helpful. I think as we move forward, as we're proactive in engaging families and including them, it can only help the direction of the network. Next slide. And then finally, some of the things that we've accomplished as an FAC. Parents are involved in reviewing 20 of the toolkits. AARC research call participation. Prior to any of the research engagement, there's a call where families get to provide input on what the subject matter will be of the research activities. The AARC renewal was just up. We had the opportunity to review that before it was published and provide family perspective on exactly what we thought was important. We also are on each of the research committees. We review proposals and RFAs. A really active and engaged family advisory committee changes the tone of all these activities. So now I'm going to turn it over to Janet Seide from our Cincinnati Children's Hospital for her presentation on family engagement. Janet?
Thank you, Tom. Thank you, Tom, and thank you to Audrey and to the Autism Treatment Network, AARC, for organizing today's webinar and for inviting me to present. Let's get started by defining what family engagement can mean to a program or an organization. In this presentation, I refer to the hospital setting, but family engagement is applicable in other settings and environments. Family engagement is part of a culture. It's a continuum. It's expected and institutionalized when clear guidelines are defined to involve families in program planning and policy making. Family engagement sets an expectation that value will be added by families. So what is the value added and what are the benefits? Family engagement improves multiple aspects of hospital performance, including quality, safety, financial performance, patient experiences of care, patient outcomes, and patient satisfaction. Recognizing these benefits can help to reduce barriers that hospitals have to practicing family engagement. But family engagement is not a new or separate initiative. According to a new report that was just released in March by the American Hospital Association's Health Research and Educational Trust titled Partnering to Improve Quality and Patient Safety, family engagement is now going beyond asking patients and families to pick paint colors or lobby furniture. The true next frontier, according to Marty Stepniak's Hospitals and Health Networks article on this report, healthcare consumers are now getting a seat at the table to improve quality and patient safety. It's a critical part of what your hospital or site may already be doing to improve quality and safety and moving the needle on those areas. This work may be more difficult but has a greater impact on outcomes. If you're already practicing family engagement at your organization, here are some ways that you can make it even more ingrained into your culture. Next slide, please. How do we accomplish a culture of family engagement? We ensure that family voice and views are incorporated into hospital policies and procedures. We make families part of the team by having them be an equal partner. In order to have meaningful engagement, we need to give families a meaningful role. We must recruit families with a purpose, providing and building the support they need to be part of the team. But including them in a multidisciplinary team with clinicians and hospital leaders, we can count on them to provide us with their expertise on family issues and needs. In order to embed family engagement into the culture, we need to all be on the same page and agree that families add value to the discussion and help change outcomes. The key to this is having staff champions of family engagement at the table and getting the buy-in of hospital leaders to create this culture in an organization from the top down. In addition, you will also need to get buy-in from the individuals in your organization who are doing direct services with families. This helps to foster the culture of engagement. An organization has a great opportunity to integrate families' input by listening and respecting their feedback and incorporating it into their operating and decision-making processes. By doing this, leaders will be more successful in promoting a culture of partnership. If the family's contributions are considered unimportant by the leadership, then other staff members will not have the expectations that the family's feedback should be considered thoughtfully and acted upon. Next slide, please. Last spring, the leadership in my division of Developmental and Behavioral Pediatrics recognized the need to formalize family engagement and charged myself and 2 colleagues to create the first Family Advisory Council in our division. To stress the importance and value of this new council, the leadership added it to their organizational chart on the same line as their leadership and the board of directors. They also made the creation of the FAC part of their strategic plan, which included family engagement in their mission and vision. In order to connect, engage, and sustain our FAC, we established subcommittees to work on projects in partnership with leadership for the betterment of the division. The FAC has made great strides in a relatively short amount of time. The Council just celebrated its first anniversary earlier this month. I would like to discuss each committee and some of the accomplishments they achieved during the past year. Our first committee is marketing. Their project was to publicize the FAC to families and the rest of the organization, and they wrote a great article called DDBP Families Lend Their Voice. Later this spring, they will help create the first DDBP Resource Fair to help families connect with resources within our division and collaborations we have with others within our organization. Our second committee, the Outcomes Committee, has worked with the James M. Anderson Center for Health Systems Excellence, our Quality Improvement Center, to understand from a family perspective what areas or themes are most important to determine how well a child with autism is doing, and how can our division help improve an outcome for an individual with an autism spectrum disorder. Our third and fourth committees focus on the patient experience from two perspectives. The first group gave feedback to improve our center's facility and make it a welcoming place for our families. They accomplished this by conducting an on-site walkabout with the other family members and staff. Due to their constructive feedback, their input is being considered by hospital management, and changes to signage will be made over the next month. The second patient experience group reviewed our welcome packet and redesigned our welcome letter to families, which was recently approved by leadership. The last subcommittee is our steering committee, which is involved in the planning of the FAC meetings, policy making, and reporting of the Council's activities in the form of an annual report. Their involvement helps to provide an ownership in the Council, which will help sustain it for the future. Next slide, please. In addition to the outcomes work I spoke about on the previous slide, myself and my family partner, Heather Innes, represent Cincinnati Children's on the FAC, Autism Speaks ATN AARC, and as such participate in the quality improvement work of the network. This past year, the network worked on such areas as sleep, constipation, and access. Each site of the network was given an area to improve. We were charged with improving access for our families from first appointment into our center. Heather and I meet twice a month as part of a multidisciplinary team to work on these efforts and other quality improvement initiatives. Next slide, please. When I was hired almost 3 years ago, I was charged with improving our outreach program to family and professionals in our community. Also, along with the outreach coordinator, who is a psychologist in our division, we created a family member and professional model for our presentations in which we both present and represent these individual perspectives. It has been well received. We also have expanded the trainings that we offer to include additional topics such as anxiety, behavior, building executive functioning skills, life with a brother or sister with an autism spectrum disorder, and sharing a diagnosis with your child. Next slide, please. I don't believe we can have true family engagement and truly hear the voice and views of families without hearing their personal stories. Hearing family stories helps set the tone in an organization and reminds staff to plan, perform, and fulfill an organization's mission, vision, and values with families and patients in mind. In addition, family stories can motivate and inspire action and change. This is achieved by making a connection with others and including a call to action. As I previously mentioned, our FAC completed an activity this past year in which we were working to determine from a family's perspective what would constitute a good outcome for an individual with ASD. We were asked a series of questions on a variety of topics to reach common themes in which to begin our outcomes work. We were then broken into groups by the facilitator to discuss the feedback that was given to each question and to reach consensus on common ideas and report back to the larger group. Each group was supposed to be made up of both professionals and families on the council. However, for one particular group, 3 professionals were paired with 1 family member. We decided that rather than changing the dynamics of all the groups already in discussion, we would leave this group as is. After 10 minutes, the 3 professional members were all on the same page as to what they believed to be the most important to families regarding the question, what makes a good outcome for a person with ASD? Except for one problem. The family member spoke up and said that the themes that they had arrived at were not important to her at all. An important realization was reached by the full council that often professionals believe that they know what families care about. However, without family input or feedback, professionals can often be on the wrong track, losing valuable time on a project, believing that they were in the correct direction, or at its worst, spending time and money to a project's completion and not being able to implement due to the fact that their consumer is not at all interested in their product or service. In our health system, we have been limited to shorter visits with our physicians. Due to these time constraints, often the priorities of the families are never reached during the appointment. A short time ago, our clinic was testing an instrument to determine and identify family concerns. After I filled out the paper form during a doctor visit with my son and handed it back to the physician, it was noted that the priorities or needs that I had written was not what the doctor would have discussed with me during the visit. She was thinking that we would be speaking about school during the appointment, perhaps getting additional services, when actually school was going quite well for my son at the moment, and my true concern was family stress. Using this scenario, one could see that it would be difficult to reach family-centered care when both the doctor and the family are far away on the core issues that impact the family, and in turn help to set priorities for the family to address. This can greatly affect the family's motivation to develop an action plan and move forward because they are being told to concentrate on issues that they do not see as a priority. This in turn impacts an individual's outcome, and little progress can be made. I'm going to end my presentation today with a quote from the Cooper University Hospital in Camden, New Jersey. The following is a part of their vision statement. Our families, patients are our partners and have knowledge that is essential to their care. Next slide, please. I hope this presentation helps to either start or continue the conversation of family engagement at your own sites. As you have heard, there are many opportunities to engage families at all different levels and systems. Next slide, please. For additional ideas, please see the resource Guide to Patients and Family Engagement in Hospital Quality and Safety, and the website is listed. Thank you for your time and participation in today's webinar, and I think we're going to open it up now for questions.
Yes, thanks so much, Janet. If folks had questions, now is the perfect time for question and answer.
Janet, have you seen any difficulties with families becoming involved with planning research or providing input to research studies that the center might be planning to start?
Is your question about whether or not families have difficulties getting involved in those studies?
I guess one question is, do they have difficulty getting involved? Number two, what are some of the barriers or obstacles you see to that? And finally, do you have any advice for those of us on the call on how we can help facilitate our family advisory members in participating at our own institutions?
Well, first of all, I think that, thanks for the question, Dan, and I think there's a really great opportunity now. I see that the trend, especially at our center, has been to involve more families, and we have several examples of that with our FAC. We have a lot of our researchers have come to the FAC at our center and have asked for the opinion of the family members because they don't want to get into the situation where they're developing something and it goes along the wrong track. So we had somebody come, a practitioner come to our FAC and ask about a shared decision-making tool that she was using, and she wanted to test it on the families and see if that she was on the right track. We also had somebody that was working on a bullying project with ASD, and he also came. So I see that the practitioners are very open to getting the families to be involved in this, and I think that some of the barriers that were there before, maybe, opening up their research to families, not really understanding if the families were going to understand what they were doing or not. I think some of that has changed, and I think that they're much more willing to do that on the family side. I think they really appreciate being asked because, this is the lives that they're leading on a daily basis, and they're an expert on their own children, so they have a lot to bring to the table. So I think that things are starting, we're having a perfect storm. I think things are starting to come together from both sides, and I think that practitioners are recognizing that, and I think families are very happy to get involved and contribute in any way they can. I know that our FAC at our center, the family members have been extremely appreciative to participate in any research that's been, asking for their feedback or input.
Thanks. I know at our own center we've had families who were hesitant because they thought, well, I don't know anything about research. But once we got them involved for some studies that, for example, required some lab work or drawing blood, an investigator thought that they needed to get 3 or 5 blood samples, and very quickly the family advisor was able to say, that's just not going to work for most kids. You're going to have a hard time getting families to participate. Do you really need that many blood samples? And so, as it turned out, the study could be done with fewer, and that kind of input probably helped contribute to the success of the study. So I think that at any level, family input into the development of studies and the ongoing conduct of some of these studies can be very valuable.
I agree. We're seeing the same thing, and both of those were very evident when we had the researchers come in and ask feedback. It really helped guide their study. I think they were very impressed with what the families had to say, and the families do add a lot to the table, even though they think that they don't have any experience in the research. They have experience in their children, and like I said, they live the daily lives, and they really do bring a lot to the table.
Very good. Audrey, do we have any other raised hands or questions from the audience?
No, I just wanted to remind folks that you can, if you want to ask a question over the phone, you can raise your hand. And we do have someone just asked a question about best practices for recruitment for family advisory committees, specifically any suggestions about effective outreach to communities of color and communities impacted by poverty, to really kind of make sure that we're being as inclusive as we can with recruitment for FACs.
Tom, I know you've done a lot of work in your center with recruiting families.
Absolutely, and I think once again we kind of go back to it being a process. One of the things that most of the FACs, the local FAC sites, started out in an informal process where it really was a system of talking with the PIs and the researchers about those families that they thought might be good. Informal introductions, informal invitations. As the requirements and as the kind of goals and structure changes, so does the method of recruitment. Becomes more structured, becomes more of an application process, so that there's a more structured, more organized, definite method for entering the FAC and being a part of the FAC. I think for each site it really depends on where their organization is, where the site is on family engagement. And some sites right now, some of our new sites, are jumping right in with an application process for the FAC. Which I think is fantastic because they're starting out a little bit ahead of where some of the other sites started 4, 5, 6, 7 years ago. There is a development guide, an FAC development guide that the Family Advisory Committee put together that goes through kind of each of the steps of developing a Family Advisory Committee, as well as we utilize the NICHQ site for their family engagement guide.
And as far as, as I was just going to add, as far as our recruitment process is concerned, we recruited for our FAC through the outreach programs that I mentioned. So we hold about 4 or 5 trainings a month, and every time we get about 15 to 20 people at least to every training. And so we were recruiting through that process. Every time somebody would come, we would mention if they know of anybody or they're interested themselves. There was an application process. We also reached out to community-sponsored groups to help us recruit. So we're a division that doesn't only see people with individuals with ASD. We also see individuals with Down syndrome and spina bifida, and we reached out to those community-sponsored groups as well to be able to help us with the recruitment process. We placed flyers in various places around the community, and then we also publicized through newsletters to help recruit as well.
And I think it's real important that all of the sites and all of the people who are considering developing an FAC are very aware of what their community is made up of, what the population is, what the cultural diversity is there, so that they can represent each ethnic area in a realistic way, so that we have participation across the board in ways that make sense. And I'll say that you see it, the Cal Irvine group, they're developing a family advisory committee kind of on 3 fronts. They have an English-speaking, a Spanish-speaking, and a Vietnamese-speaking family advisory committees that they're developing based on the makeup of their community and really meeting the needs of their community.
Great. Audrey, do we have any other questions?
No, we don't have any other questions currently.
I might just chime in here since we don't have any questions. A thought that came from some of Janet's comments was with familiarity comes comfort and knowledge. I think the more that we have family members and researchers and academics in the same room together, the more and better we'll be able to address the issues at hand. We'll start to be comfortable asking questions both of families and from families, and the discourse will continue to improve. So I'm a real proponent of the more often we can meet, the more often we can engage, the better that we'll be able to make sure we drive the treatment.
I agree, Tom. I think it's something that we're certainly aiming for. You mentioned Pat Cloppert, who was our first family representative or advocate to the ATN. And when I was talking with her and thanking her for her involvement, and I said, you know, I don't know what we'd do without you. And she said, well, you should have more than just one of me. Really want involvement. And she was the one who really helped spur us to start developing our FAC several years ago. And so it has certainly grown, and we've become a very active and enthusiastic advisory committee. And I'm very pleased with how things have been developing in that way for the network. Well, as I mentioned, our other speaker for today, Amy Craftsman, is certainly showing her advocacy by attending this congressional hearing in Washington, D.C. today, and so it conflicted with this presentation now. But we did manage to get her presentation recorded in advance, and you can check out her webinar on the AARC YouTube channel. It's already there, so do feel free to check that, and I hope that you'll have a chance to check on it soon.
And Dan, I just wanted to add, we had a comment from one of our FAC members who's on the call, and she just wanted to mention kind of along the same lines of what Tom was saying with UC Irvine's work with their FAC, having an English-speaking, a Spanish-speaking, and a Vietnamese-speaking. She just mentioned that a lot of our FAC, the network FACs, are very diverse for recruitment purposes. That sometimes it's important to remember that cultures find it easier, different cultures find it easier to relate to each other. So that just to mention that our FACs do have some diversity for recruitment and those types of activities. So she just wanted me to mention that.
Very good guidance. Thanks very much.
And then just kind of back to what Dan was saying, I just wanted to, again, just Amy Craftsman was her presentation on family engagement from a research perspective we were able to pre-record that, and it is available. Here's the link to our YouTube page.
Super. Well, if there are no other questions or comments, I want to thank our speakers today for all of their wisdom that they've shared with us, and I want to thank all of our attendees, and I hope that all of you have a wonderful rest of your day and the rest of your week. We'll talk with you all and see you all soon. Bye now.
Thank you.
Thanks, everyone.